What are the side effects of a duodenal switch surgery? We can basically go on short-term or long-term surgical related side effects or nutritional related side effects. So let's talk about short-term. Complications or side effects or problems with the duodenal switch on the short term either are required to be solved in the hospital. That means bleeding, leakage, or hernias that needs to be solved in the hospital. Fortunately, the complication is less than 1%. So duodenal switch surgery on the surgical part has less complication than major surgeries. It's a very safe surgery. But that means that we need to be very careful to make or to keep making duodenal switch a very safe surgery. So we talk about bleeding. We're stapling and cutting intestine, and we're stapling and cutting the stomach. The duodenal switch surgery is the surgery that has more staple lines than any other weight loss surgery. We're creating a gastric sleeve, and then we're cutting the duodenum, and then we're cutting the intestine, and then we're cutting the other part of the intestine, and then you have two anastomoses to attach duodenum with ileum and jejunum with ileum, and then having the stomach over suture. So it's a very, very big surgery. So the risk of bleeding can be higher if we don't take care of that proper issues. That means getting a full lab work, having our patient very well hydrated before surgery, avoid taking any NSAIDs or any medication that make your blood thin. So walking after surgery helps, walking before surgery helps, getting oxygen blood supply helps, but having the proper tools to do the surgery and having the proper time to do every single staple line cartridge fire, it's very important. That means that the risk of bleeding is low. And then over suturing and closing everything in one or two different layers will make the bleeding go very, very, very low. So bleeding is one of the risks. What about leakage? Well, as I told you before, it's the biggest weight loss surgery with the most staple lines in all the weight loss surgery. So leakage could be a bigger complication. That's why we perform all the leak tests before or during surgery and two more before you leave the hospital. So, and we leave drains so we can know that something is going on. What happens if you have a leakage? Well, basically there'll be fasting, nutritional support, drainage, or we can go back to surgery. Most of the time it resolves very simple with surgery, and it's quite easy to take advantage of the new therapeutics. That means that we can do drainage with a CAT scan, or we can be less invasive to resolve problems. What about long-term complications? Well, the first of all, it's something very common with the gastric sleeve, and it's acid reflux. It's common that with a gastric sleeve we can have around 15-17% of acid reflux. In that case, it's related either to food or is related to just acid production of the stomach. So you need to take PPIs, and if the acid reflux is not resolved with PPIs, then it's a bigger issue. We need to check, either do less invasive procedures, or we need to convert that surgery to a gastric bypass. Then, on the long run, hernias or internal hernias. When you lose all the weight, all the fat that is in the mesenteric aspect of the stomach, it's getting loose and you get more holes, so the limbs or the intestine can go into that holes. So basically, when you have more space, the limbs or the intestine, the loops move around and they can stay in one of that hole, and they can be strangulated, and that will be a major reason to do a surgery. Then the other complications are nutritional complications. Nutritional complications flow from protein deficiency, anemia, calcium problems, kidney stones, lack of vitamin A, D, E, and K. So we need to take care about the supplementation after surgery. And the other complications could be symptoms, digestive symptoms. Most of the time, they're very simple to correct. That means that if you're eating a lot of carbs, starchy carbs, probably you'll get a lot of gas because the microbiota of the intestine, that means the good gut bacteria, will basically fermentate that sugar in your system that will go to the intestine because it's not properly absorbed, and you'll have a lot of gas. So the easiest way, it's basically either take medicine or help yourself with some enzymes that will avoid that malabsorption. The last of the problems will be to have a little bit less malabsorption, and it's a very simple surgery where we shorten that common channel or lengthen that common channel so you have less malabsorption and more absorption on the last part.